Leadership for Adolescent. My name is Minjue Wu, and I am an officer with the IAAH Emergency Professionals Network. It is a pleasure to serve as your moderator today. We're joining from different countries, time zones, professional backgrounds, and stages of our careers, but we're coming together around a common question, which is looking at how can technology, partnerships, and meaningful youth leadership work together to advance adolescent health. We have an exceptional group of speakers with us today, and I'm very much looking forward to the conversation. So before we begin, just a few quick housekeeping points. This is going to be a roughly 60, 75-minute interactive webinar. So we will begin with a brief framing from the IAAH Emergency Professionals Network and then move into a moderated panel discussion, followed by audience Q&A and closing reflections. So for those of us who are now trickling in and joining on Zoom, please go ahead and keep your microphone muted unless you are invited to speak. We encourage you to use the Q&A function and the Zoom chat to submit questions to the co-host during the discussion. If you experience any technical difficulties, please do use the chat or the appropriate Zoom support functions, and we will do our best to incorporate any and as many audience questions as possible during the Q&A segment. So we'll give another minute for folks to trickle in. And as we begin, I'd also like to remind everyone of our commitment to a respectful and inclusive conversation. We have people joining from so many different contexts and disciplines, so we invite everyone to engage with curiosity, respect, and openness. All right. So welcome, everyone. Thank you all for joining. Those of you who are just coming in, please go ahead and familiarize yourselves with the technical platform. Feel free to use the Q&A function or use the Zoom chat to submit any questions to the co-hosts. Please keep your microphone muted, and we'll get started in just a little bit. All right. And with that, I'll hand it over to Surabi, IAAH EPN co-chair, to introduce the organization and the Emergency Professionals Network. And so, Surabi, over to
Thanks
you.
so much, Minju. Thank you, Minju, and thank you, Tomeva, for starting us off. If we could go to the next slide. We'll do a quick introduction, as Minju said, about the IAAH. So on the screen, you can see the amazing 2025 to 2028 Council led by President Maria del Carmen. So the IAAH is a multidisciplinary non-government organization which aims to improve the health, development, and well-being of 10 to 24-year-old adolescents and young adults in every region of the world. And IAAH is committed to evidence-informed practices and policies to ensuring that young voices are a part of this work. And I feel strongly as a co-chair that EPN is a great example of that. So these are some of the people who are behind the IAAH Council. If you go to the next page, you'll also see some of the regional VPs, the people who are trying to make adolescent health central to policy and practice and empowering young people to attain optimal physical health and mental well-being. Shout out to two regional vice presidents who were former EPN co-chairs, Melissa and Diana, that you can see on the screen. And this represents, as you can see, from the Caribbean to Sub-Saharan Africa, South Asia, and Oceania. Next slide, please. We also have special advisors advising the IAAH, and again, a special shout out to the International Adolescent Health Week Director, Dr. Nangozi, as well. If we move to the next slide. Yeah, so the Emerging Professionals Network, I think most of you would be familiar, but just to give you a quick recap of who we are. We were established in 2018, and we're a community of students, trainees, early career professionals in our respective fields. Some of us are doctors, researchers, practitioners, advocates, social workers, etc., coming together within the last decade or so, and we work on supporting networking, mentorship, and leadership development in adolescent health. If we move to the next slide, some of our goals range from educational and professional development, mentorship and leader development, collaboration and partnership building, as well as advocacy and building a collective voice. In terms of our objectives, we have an amazing WhatsApp community which comes together on this online platform where from across the world we share brainstorm ideas on adolescent health, share opportunities with each other and build each other up. So we will be sharing the QR code and link in the chat as well for you to join if you're not already a member. And we're looking forward to contributing to regional and global adolescent health initiatives and creating and promoting educational and mentorship opportunities and working with the IWH Council to have youth as active, not passive partners in shaping research and policy. If we move to the next slide, you can see the amazing co-chairs that we have, and I'm so lucky to be working alongside them. Asta Ramaya from the USA, Eleni from Greece, Tomiva from Nigeria. I'm from India, currently studying in Australia. And these are four amazing co-chairs who are leading the current term of the EPN. If we move to the next slide, you'll get to know that along with Minju and Felicity, we are in the process of recruiting some of our amazing officers. As you can see, had some brilliant applications from across the world, from different regions, and soon we'll be publishing the finalized names of the new incoming officers. So please do watch out this space for the updates. We're excited to welcome them and move ahead in this collective aim that we have for the IWH EPN. Next slide. We also wanted to shout out, as you can see on this slide, something called the IHW, which you may be familiar with, the International Adolescent Health Week. And it's an initiative that brings together, again, young people, healthcare providers, teachers, communities to celebrate adolescents and promote their health and well-being. And we would love to invite you to join us this year. If we move to the next slide, you'll see the dates are 12th to the 18th of October. And this year in particular, we are celebrating the 10th anniversary of IHW. And the theme is Nothing About Us Without Us, Power, Voice, and Health Equity for All Adolescents. So we hope that you will join us in this celebration that's coming up in a few months. Next slide, please. Yeah, and just a reminder, please to scan the QR code. If you're not already part of our growing community, you can join the WhatsApp community today, get updates from the IWH EPN, share and connect with other young professionals, emerging professionals that are a part of this network. We'll also drop the link in the chat as well. And then I think my fellow co-chair Eleni has done that. So thank you so much again. That's just a quick call out to please consider joining the EPN WhatsApp community. We'll be really happy to welcome you. And I'll pass it back on to Minju.
Great. Thank you so much for that introduction. And then next, we can hand it over to Asta to introduce the starting point for the conversation we're about to have. Um, so, Asta, do you want to take over?
Thank you so much, Minju, and thank you so much, Sarabi. Just wanted to welcome all of you here. Good morning, good afternoon, good evening. It means a lot to all of us for you to be here on a Saturday. And I think one of the things that we wanted to highlight today through this webinar is the importance of International Youth Day. So before I talk, I did want to open up, given that we have 40 people here, I did want to open up and ask you to maybe type in the chat or go off mute and just give me one word that comes to you when we say International Youth Day. What does it mean to you? Just give everyone just a minute. Okay, Eleni said fiesta. Surabi said power. Anyone else? Equality of voices, advocacy, upcoming, progress, innovation, community. This is, when we think about it through the through the asset-based lens, this is what opportunity looks like, and this is what the future look like. And that is exactly what the International Youth Day celebrates. It celebrates young people as critical as well as necessary partners in addressing challenges to achieve more equitable and sustainable futures. This day, and I would compel all of you that let's not only focus on this day, let's focus on all days and the entire year, which gives opportunities to governments, youth organizations, multilaterals, civil societies, academics, as well as all stakeholders working with young people to increase communication, strengthen partnership, as well as showcase the examples of youth-led initiatives. We know that this year the theme focuses on how young people's lives are a function of the environment and the context they live in. And we also are aware that all young people want opportunity, dignity, equal participation, as well as working opportunities that meet their potential. Our incredible panel today demonstrates designers building the tools, scientists producing the evidence, implementers navigating the funding situation that we have, researchers co-creating with communities, and partnerships that lead to embedding youth voices into governance structures. Each speaker is creating the opportunity, the participation, and systems level change to make sure that nothing happens without us. And everything starts as well as ends with inclusion, participation, and intention. Thank you. Minju, over to you.
Great. Thank you so much for that framing, Asta. Um, and as we're heading off into the conversation, before we begin, I like to also extend two shout outs. The first is a very special welcome and thank you to Dr. Maria Carmen, President of the International Association for Adolescent Health, for taking the time to join us today. We're very grateful to have you with us and really appreciate you for making time for this conversation, along with all the other folks joining today. I'd also like to give a special shout out to Dr. Arisolo Olumide, researcher and consultant community physician, and also the IWAH Vice President for Sub-Saharan Africa. Thank you so much for joining us. Well, we're delighted to have both of you with us today. And so with that, I think that has given us a useful starting point for the conversation we're about to have. So the 2026 International Youth Day theme, again, is Youth Advancing Multilateral Cooperation Through Technology and Partnerships. And so for adolescent health, that theme raises some particularly important questions. Technology, we see, is changing how adolescents access information. It's changing how they interact with health systems and also how they experience social and emotional support. But technology alone doesn't determine whether those changes are equitable, safe, or effective. That really depends on who's designing the systems, whose evidence really informs them, who governs them, and who gets a meaningful seat at the table. And that brings us directly to our panel. So today's discussion will be organized around three connected questions. Firstly, what does it actually mean for young people to move from being consulted to actually becoming genuine leaders and partners? Secondly, how well do existing governance and evidence frameworks reflect the reality of digital health as is actually experienced and built? And thirdly, how do we move from research and innovation toward policy, implementation, and durable partnerships? And these are designed to be deliberately practical questions. So instead of asking only what should happen, we want to hear from people who've actually been inside these systems, building technologies, conducting that research, working with multilateral institutions, developing partnerships, and leading youth-centered programs. And so we're really fortunate to have eight perspectives represented today, spanning youth leadership, multilateral policy, digital health and AI research, implementation, and partnership development. So we're going to start off with, I think, what is one of the most foundational questions for everything else we'll discuss, which is what does meaningful youth leadership actually look like when we move beyond consultation? So quick shout out to the eight speakers. We'll have in order Dr. Venkatraman Chandramudi, who cannot make it, unfortunately, today in person, but has sent us kindly a video, which we'll show for our first question very shortly. Margaret Rulaji Adebola, and Leah Prudence, Tino CK, Hilda Okafor, Dr. Joni Marlene Bewa, Dr. Zoe Yue, Parna Raj, and Eleni Koranidu. And so I'd like to begin now with Dr. Venkatraman Chandramuli. Dr. Modi has worked for 30 years in the World Health Organization, leading work on adolescent sexual and reproductive health and rights. His work focused on generating and distilling research evidence and program experience and using that evidence to strengthen national policies and program. Since retiring from the WHO in 2023, he has continued to teach, advise, and support Adolescent Health Network. So, but Dr. Chandra, who is unfortunately unable to make it live today, has kindly sent us a video. And so the question we most posed for him is surrounding the evolution of adolescent participation over several decades that he has witnessed, including experiences in Malta, Nepal, and Zimbabwe. And so we asked him, it's been over 30 years since the International Conference on Population Development, and you have seen how adolescent participation has evolved. Where do you see a divide between leadership and tokenism today, and what are tips, what tips are context from one side to another? So I'll go ahead and hand it off so we can display the video he has kindly sent to us.
Hi, Minju. Just a moment. We're trying to pull the video up. Asta, are you able to from your end?
Yes, to me, sorry, what happened?
All right. Can you share the video from your end?
I am.
It's okay. We're watching the video.
Oh,
Yeah.
we can't hear
Yes,
the
yes.
audio, so you have to share the audio, I think.
No, everyone else is able to hear it.
Oh, you can hear it. All right, great.
Yeah.
Thank you.
Sorry.
From very little awareness of them and their needs, to seeing them as groups which need help and groups which could be difficult, to acknowledging that they have an important role to play in the solution. While there is certainly more meaningful involvement of adolescents today, and even to adolescents setting and driving the agenda in some areas, there is still, sadly, a lot of tokenism. I used the opportunity of preparing a background paper for the health chapter of the State of the World's Population Report 2026 to document case studies of successful national government-led civil society included programs that improved different areas of adolescent sexual and reproductive health and rights. Not surprisingly, adolescents and young people played an important role in several of these programs. One such program is Zimbabwe, which has made impressive progress in reducing HIV infections and HIV-related deaths in adolescents and young people. In Zimbabwe, as in Mexico, Nepal, and Malta, young people play a key role in program delivery and increasingly in program design and review. To conclude, what contributed to meaningful participation and leadership in Zimbabwe? 3 points. Identifying a pressing need that adolescents could play a key role in addressing, meaningfully involving them in designing, delivering, and assessing programs to address the need, and also in shaping policy, and institutionalizing their involvement in work plans and budgets. Adolescents showed that they could play a role that adults could not in preventing HIV and preventing HIV deaths. They earned a place at the table, and championship from the adults who worked with them ensured that place became permanent. To sum up, we need to define adolescents' role with them, mandate their contributions, and support them administratively and financially if we want meaningful participation and leadership. Thank you and namaste.
Right. Wonderful. So once more, shouting out to Dr. Chandra for sending that video, despite the fact that he cannot make it in real time for the participation. And I want to, as we are thinking about the takeaways, stay with that distinction that he raised between structural participation and symbolic participation, because it takes us directly to our next speaker. And so I want to introduce Dr. Margaret Valaji Adegbola, who has spent more than a decade working across research, implementation, and management in adolescent and youth sexual and reproductive health and rights. Most recently, she served as the Youth Partnership Manager with FP 2030's Northwest and Central Africa Hub, leading partnerships with youth and civil society organizations across more than 30 countries. She's now Country Impact Manager and is also the founder of Stand With a Girl initiative in Nigeria. So, Margaret, you lived the transition that Dr. Chandra is describing. You went from seeing one youth seat in 2016 to serving in a formal youth partnership manager role after 2020. So, for you, we want to ask what actually changed when youth moved from being in a consultant or advisory role to being paid staff and institutional partners? And perhaps most importantly, what changed in the decisions being made? Margaret, over to you.
So I'm very grateful for being here, and thank you for adding doctor to my name. I'm not yet. Until then, I'll keep you posted. I think I would like to begin by saying I love how the global consensus statement on meaningful adolescent and young people's definition of what it should be. It was, of course, set in 2018, but I feel it's still very relevant today. It's quite a mouthful, but I would just like to quickly say what it says about meaningful adolescent and young people and youth engagement. It is an inclusive, intentional, mutually respected partnership between adolescent, youth, and adults whereby power is shared, respective contributions are valued, and young people's ideas and perspective, as well as skills, strengths, are integrated within the design and delivery of programs, strategies, policies, funding mechanism, and organizations that affect their lives and their communities, countries, and world. Because this really, it's a guiding principle for us at FP 2030. So in 2016, then it was FP 2020, now FP 2030. We became more intentional about strengthening the engagement with young people by integrating them within the highest level of governance. So we had the reference group, which I was opportune to be the first youth representative on that reference group. 18 persons decision-making board. I was the only young person. They were very accommodative, helped me to grow. But even when I was stepping out of that role, which I took for a year plus, almost 2 years, I did recommend that at least it should be two young person. Somehow it helps you get comfortable, but it's also the fact that here is Margaret representing 1.8 billion of young people across the world. I felt that we needed more diverse voices in the room. And of course, that recommendation was taken seriously. We went on, that's FP 2020 at that time, to include young people in other they had two and then moved to even over 10 of young people in very strategic leadership roles. And I'm very intentional about mentioning strategic leadership role because it's one thing to have young people as advocates, you consult them, but in this term, we're moving away from tokenism to having young people take decisions. So it was across the transition oversight group when we were transiting to 2030. It was also the governing board, the PME working group, and the communication branding process. All of this had young people equipped capacity built and representing the voices and unique needs of adolescent and youth. But beyond that, it's also that there are now youth focal points across over 50 commitment-making countries who are ensuring even broader and more inclusive representation. I see Felicity, used to be the youth focal point representing Nigeria. There's several of them across the globe. And also building on this same momentum, FP 2030 decentralized to the regional hub. That was in 2022. And that was that time that beyond just having the youth focal point, FP 2030 had a paid role for young people to lead adolescent and young participation efforts across the 5 regions. So I was the youth manager at Northwestern Central Africa until recently, this very year, a few months ago, where I transitioned to being the country impact manager. And our role was to ensure that we're shifting beyond just representing young people to having strengthened, meaningful engagement at both regional and national levels. So we had a strategy dedicated to adolescent and youth, co-created with young people and other partners. We had dedicated funding because investment in young people, the funding also does matter. And all of this put together really just help us to have a dedicated quota. Even within the partnership fund, we had 40% going to youth-led organization, and also in terms of building their capacity, supporting representation at national, regional, and global platform. As I wrap up this, because I know I have a few minutes, what changes did we see? What we saw with all of this structured investment and representation of young people was the fact that we had a strong and sustained presence of young people in FP 2030 system as well as the structure. We saw changes or continue to see changes in youth leadership, young people, whether they're on technical working groups at their country, regional, or national, global level, they were shaping the policy, the program conversation, also collaboration between government and youth actors, and also positioning them really as leaders, as experts in their own field when it comes to issue around sexual and reproductive health and rights. And for us, it was really a great way to transition from having just one person. You represent 1.9 billion young people now, to having them across all of our commitment-making countries, but also having dedicated budget and leadership roles specific to young people. Thank you so much, and over to you.
Thank you so much for all your insights and shared perspectives from on the ground, especially looking at that remarkable transition and spearheading the head of those changes as well. So Margaret has talked a lot about the institutional structure and how young voices can shape that. I want to further bring this down to the lived experience of youth networks now with our next speaker. So I want to introduce Anne Prudence, who's a final year medical student at the University of Botswana, serving now as a youth advisor for the International Adolescent Health Week, where she's supporting the coordination and mentorship of youth ambassadors globally. She also works in global digital health and medical student leadership through the Federation of African Medical Students Associations. So over for you. When you were hearing Margaret describe the distinction between the symbolic youth role and a structural one, what does that distinction actually feel like from where your network sits? And so what tells a young person essentially in practice that their participation is genuinely valued rather than simply being used to demonstrate that youth were quote unquote included? So Enle, over to you.
Thank you so much for that. I really do appreciate what Dr. Chandra and Margaret shared, because when you work directly with young people, you will then get to quickly realize when an opportunity is genuinely meant to empower the young people or simply just looks good on paper. So for me, usually the difference comes down to just one question. Are young people being given a voice, or are they being given a role? So as a youth advisor within International Adolescent Health Week, I work with youth ambassadors across different countries. And one thing that I've learned from experience is that young people don't come into these spaces empty-handed. They actually have a lot. So these young people, they tend to come with knowledge of their communities, their peers, their cultures, the health issues that they face, and so much more. So if we invite a young person into a program when we have already made a lot of decisions already, and we say, come share your opinion, then we are leaving a huge amount of that value on the table. I've also learned that meaningful engagement is not always about giving young people big titles. Sometimes it is just about whether you trust them with real responsibilities. So, for example, within a Youth Ambassador Network, leadership can mean helping another young person navigate their role. So, supporting them to develop an idea, coordinating across different countries, contributing to planning, or creating opportunities for other ambassadors to be heard. And that's really what's important to me, because I don't think youth leadership should be about creating that one exceptional leader that we invite to panels and all, but rather it should be about creating a pipeline of young people who are equipped to actually lead and are competent. So working with youth ambassadors has made me realize that there's a difference between giving someone a platform and giving them ownership, because a platform would say, come and speak, and that's where it ends. While ownership would say, come and help us decide what we should be doing. And we actually trust that young person to make it happen. And I think that's when we move from token consultation to then having genuine leadership. The other thing I've observed is that young people don't all need the same thing. Some may need mentorship, while someone else may need an opportunity to lead. Another person may simply need someone to trust their idea enough to then give them a chance. So for me, genuine youth engagement is not just about having young people in the room, but creating structures where they are able to grow, contribute, and make decisions, and also eventually create opportunities for the next young person, as we've seen Margaret display that she has done that. So that to me is what turns youth engagement from representation into leadership.
That's very clear, Anthony. So what I'm hearing from you is that it's not just granting titles or space in a room, it's also providing real responsibility and the ability to move the needle through actions and space to execute along with the resources that support that. Thank you so much for sharing that perspective. So with this particular section, I want to also bring in one more perspective here, because meaningful engagement, as we've talked about, is not just about representation, but it can also fundamentally change how research and programs are designed. And so I want to invite our next speaker, Tino, to come and share with us about his leadership with the Impact Zim project, where he was working alongside communities and researchers to co-create youth-centered health innovations. Tino is a youth researcher, a mentor, and an advocate for youth-led health innovation, working at the intersection of sexual and reproductive health, implementation science, and participatory research. And so, Tino, for you, through Impact Zim, you're co-creating research with communities rather than simply consulting them. Could you share one moment where that co-creation actually changed the direction of your project in a way that researchers working alone would not have seen? And maybe equally importantly, what assumptions did that process challenge? So, including assumptions within youth movements themselves. Tino, over to you.
Thank you very much. So before I begin, I would like to mention that I am a testament to Dr. Chandra's work because I am a young person doing research in Zimbabwe. So to answer the question, I first need to explain what Impact Sim is and the context of the young population. So Impact Sim is a project that is trying to understand the impact of media influencers on young men's sexual well-being and how they perceive sexual well-being. So one of the key activities we do during the workshops is to co-establish harmful narratives within mass and social media, which these young men are exposed to, for example, issues around toxic masculinity or hypermasculinity. And then from there, we then co-create counter and helpful narratives. As Asta said earlier, nothing for us without us. So an example of we can have like a narrative around consent, or one that actually tackles hypermasculinity. After that, we then devise ways to disseminate these counter messages, right? So what our young men were asking for us for was that we use influencers themselves who are pushing healthy narratives within the community. So to answer your question, one experience that has really intrigued me so far is the young men suggesting use of AI to generate our counter narrative resources, particularly use of what is called Suno AI. So Suno AI is an AI that generates music. So you just type in maybe like lyrics or an idea, and then the AI would generate like a whole song for you. So we now had to sort of like reframe our approach of disseminating these healthier narratives by also considering how to ensure that we accommodate even the marginalized populations who might not have access to digital tools or even AI, or those who might not actually understand how it works. So I believe moments like these actually reveal to us that co-creation lets the participants' framing become part of the framework, or should I call it architecture, before we even have decided what it is going to be like, if you understand what I'm trying to say. Unlike consultation, which asks like the people to react to a certain framework. So yeah, thank you.
So, thank you so much for highlighting your area of work, Tino, especially with this particular segment. I think is very much an under emphasized and also not quite as well known as the other gender counterpart. And so this is really interesting as well as important perspective to bring out in terms of how you can co-create different realities as well as engineer greater flexibility when we're thinking about synthesizing action and applicability with research. So with that, that brings us to the second layer of our conversation. If young people are going to be genuine co-architects of health systems, we also need to be asking whether the systems that govern digital health actually reflect the reality of how those systems are built and experienced. We often talk about AI governance, digital health governance, safeguards, privacy, equity, and responsible innovation at a very high level, but we rarely think or talk about what happens when those principles meet the messy reality of product development, of funding and implementations, when you get pushback or lack thereof from families, communities, and adolescent behavior that maybe should be exercising more resistance or don't have the power to. And so, with that topic in mind, let's go ahead and start from the product development side. And very pleased to be introducing our next speaker, Hilda Kafo, who is a licensed physiotherapist and digital health product designer who has worked across healthcare, AI, cloud computing, travel technology, and SMEs. She is also the co-founder of Raycare, a digital health platform that designed to extend physiotherapy beyond the clinic through patient engagement, home rehabilitation, adherence, and continuity of care. Hilda, you've actually built digital products across several of these technologies. And so, in your perspective, what is the biggest gap between what digital health governance frameworks assume about how tools get built and what actually happens when you're building them? So, in other words, how does governance theory collide with product development reality?
Thank you very much. So I think one of the biggest gap is that governance often look at the technology while the builders look at the process involved. And I would take it in 4 steps. So the first is the real world is messy. So in as much as we are focusing on privacy, we are focusing on the interoperability of these digital tools. We also need to look at context of the environment of these young persons, looking at poor connectivity, limited resources around them, their different health system gaps, and bringing in governance into that. So another one is governance often come late, and I would say it focuses more after the product is being built. And for me as a designer, we start right from research. So I think governance should start with research with them, alongside bringing in this framework into the product's life cycle. So what data are they collecting during this process? What are they assessing during this process? Who might be left out? What happens to this technology when something gets wrong? So I think that's one of the gaps. Another one I would say is a product can be safe and still not work. So probably a product have been built for like young persons based on assumptions, and they didn't actually take into consideration these young persons, putting them into the system. Okay, you have to co-create with them, you have to design with them, you have to put them on board as a starting, empathize with these young persons to know what they're actually going through and bringing them on board into the product. So another one is, like I said, young people need to be inside the room. They need to co-create. They need to also design, test, and also be amongst the governance body. And I would like to end that governance shouldn't start when the product is finished. It should start when we are deciding what to build for them. And the gap is that governance often asks whether the technology is safe and compliant. But while we, the builders, focus on the process, so I would like that, okay, governance should also be part of the process of this building. Yeah. Thank you so much.
Thank you very much. I think that's very clear looking at the guidelines or guardrails of safety versus what actually works and making sure the efficacy is the driving force. Right. So I want to put the same question into the implementation and funding environment for our next speaker, Dr. Joni Arlingbewa. Dr. Bewa is a physician scientist and public health faculty member and the founder and CEO of Total Health, which designs, deploys, and evaluates technology-enabled solutions for equitable primary, reproductive, and maternal health care. Her work has spanned telemedicine, adolescent SRHR, implementation science, and programs that have been founded by foundations and multilaterals, including work associated with UNICEF, Gates Foundation, Gavi, Bloomberg, and Grand Challenges Canada. So, Dr. Bewa, when Hilda describes the gap between governance assumptions and the reality of building digital tools, where have you personally seen that gap break down in the donor to implementation pipeline? And what is the difference between rhetorical commitment to digital health and youth engagement and the structural funding where safeguards actually make those commitments possible, especially for adolescent sexual and reproductive health? What is one safeguard or consideration that just cannot be skipped, in your opinion? So, Dr. Bewa, over to you.
Thank you very much. Can you hear me?
Yes, loud and clear.
Okay, perfect. Well, first of all, I want to thank the organizer for this great webinar, and I've had the chance of following the organization work and also work with ASTA very closely and really be a big advocate for the work. First of all, I would like to answer your question from two different perspectives. So through my work at Doto and also through some of the research that I led from implementation to research. First of all, Doto is a teleconsultation platform that connects users, especially adolescent, youth, and women, to primary care services, sexual reproductive health, focusing on adolescent, youth, right now in Benin, but also we plan to scale across West Africa. And what really make our work, our model different is that we invest in part of digital health that actually determine whether people get care and who gets care and how. Some of the services of the platform include appointment booking, teleconsultation, synchronous and asynchronous, GPS localization for health facilities and pharmacies, and our ongoing AI integration and e-shop capability. So I will be speaking from that experience as Doto's founder and CEO, but also as a researcher through some of the work that I led at the University of South Florida on telehealth and contraception research in the US, but also at the Johns Hopkins University on telemedicine implementation. So the one safeguard that we will never compromise about from our perspective and the way we do believe and implement that as part of our work is privacy by design. For adolescents, for youth, for young adults seeking sexual productive care, for us, privacy is not a compliance checkbox. It's not a regulatory checkbox. It's actually a safety requirement. And that is why we were really built on making sure that confidentiality and consent are core and center of our product design. Confidentiality and consent policy is very critical and is available on our platform, making sure that users can sign opt in, opt out at their leisure and at their convenience. The way consultations and notification appear, also knowing that sometimes users have shared phones, and this because they have shared phones, notification can appear and then sensitive content can actually be displayed. So really also provide option for users to have notification disabled or not. The way data is recorded, is stored, and who has access to data for us is a paramount governance priority, and we do align to this type of priorities in terms of encrypting data and having data access that are multifaceted. With the type of the way we protect identity as well on the platform, we make sure that we collect only personal identifiable information that are really critical to this type of services, and really do not go beyond what is critical for counseling, contraceptive care, or referral or prescription. But we also, on the AI side, because we have been integrating AI into the platform, also really critical about making sure that AI is integrated to ensure that the models are accurate, the models are safe, the models are inclusive, the models are fair, and that we step away from hallucination. So what we really do differently is that we do prioritize not just the product, not just engaging our adolescent and youth meaningfully, but also the ecosystem. And that's where we established at the beginning the Young Leader for Health Innovation, which is a group of 17 leaders selected nationwide to be part of the design, the implementation, the co-creation, the testing, the refinement, and the evaluation. So local governance through our Young Leader for Health Innovation is a critical piece of our work. Entrusting a local network of providers that are vetted, that are trained, is also one piece for us to make sure that there's local ownership and local governance. Ensuring there's also access to low data access channel, asynchronous capabilities for teleconsultation for us was critical for users that are in remote area. For example, SMS or voice calls, non-video are also some of the functionality that we are embedding into the telehealth platform to make sure that we leave no one behind. And so for us, those capacities are not add-on, they are part of the product. And the product is built on the need, but also on top of ecosystem that we are navigating in from. From a global perspective, outside of my work at Doto, but from a global perspective in other countries, Indonesia, Congo, Rwanda, and other countries, we've noticed that some partners will run proof of concept, others will support transition to scale, others will contribute to the middleman, others will support ecosystem building, provide onboarding, regulatory engagement, iterative design and redesign. And we need to find the right format where support, governance, funding, technical assistance is possible and available across the spectrum of all of those elements that I've just mentioned. Also, we know that funding cycle expects developer, users, innovators, and researchers to deliver in a specific amount of time. Yes, it is critical, but we also need to make sure that we know that behavior change, service utilization, diffusion of innovation actually take time beyond a specific funding cycle. We've been very lucky to have support from Grand Challenge Canada and UNICEF that help us invest not just in the product and the an ecosystem. To finish in a nutshell, I would say let's align innovation, governance, policy with the real user's behavior and the need. Align. Let's anchor funding into the ecosystem, not just a prototype, but everything else that is around the prototype and that I've mentioned earlier. And last but not the least, amplify. Amplify youth leadership in governance and implementation. And I think those are some of the three priorities, even though there are more, but that I think could sum up our perspective and our lesson learned from developing the Dodo app centered on adolescent and youth SRHR. Thank you.
Thank you so much, Dr. Bewa. All right. So with that, the importance stressed of both top-down and bottom-up building, let's look at now what is maybe invisible if we simply rely on the metrics that we traditionally use. So next speaker, Dr. Jing Yue, Dr. Zoe Yue, is a scientist at the Digital Wellness Lab at Boston Children's Hospital and an instructor in the pediatrics at Harvard Medical School. Her research looks beyond broad measures like screen time to actually examining adolescents' social interactions, their emotional experiences, family communication, parenting practices, and platform context. And so, Dr. As AI companions and chatbots and increasingly sophisticated digital systems enter adolescents' lives, What, in your opinion, should our governance frameworks be measuring that they currently aren't? And what aspects of an adolescent's digital experience are currently invisible to policymakers, researchers, or developers? So, Dr. Yu, over to you.
Yeah, thank you so much. Can you hear me okay?
Yes,
Okay,
you're loud and clear.
thanks. Thank you so much for the intro. I think one of the biggest challenge or issue in the current research, I've been muted.
Yes, you've
Can
just
you
been
hear me?
unmuted. Yes.
All right. All right. I think one of the biggest issue in the current research, including my own, is that sometimes we are measuring AI companionship as they are just another form of screen time. We ask adolescents how often they have been engaging with ChatGPT or Gemini or Cloud. We ask how often like they have been doing this and that, how much time they've spent their devices using AI. But the important question is not only about screen time. We should ask what happened during the interaction. So I feel like first we need to measure young people's emotional experience. How do they feel before, during, and after talking to a chatbot? Whether the conversation helped them feel better, feel calmer, or more supported, or does it make them more like anxious, isolated, emotionally depend on that? Actually, from my own research, we found that um, among daily users of generative AI in the United adolescents, over half, 51% of them, have engaged emotional conversations with chatbot. In our Brazil sample, we actually found like 58% of daily users they've engaged um, emotional conversations with chatbot. So I feel like first we need to measure young people's emotional experience with all these generative AI tools. Second, I think we need to understand the relationship young people are developing with chatbot. Do they see this chatbot or generative AI as a tool, as a friend, as a therapist, or just authority figure? Are they sharing things with chatbot that they wouldn't share with a parent, a friend, a teacher, or a clinician? And is a chatbot supporting their real life relationships or like gradually replacing them? In our own study, we also find that 40% of the teens in the United States, they feel like AI can serve as a friend. Daily users of AI tools, half of them, 50% of them, they say that they are developing close relationships with AI chatbots. Um, Third, I feel like we need to study the system's behaviors as well. So what happens when a teenager talks about sensitive topics, including like self-harm, abuse, sexual health, loneliness, or other sensitive issues? Does the chatbot respond in a safe way? Does it protect their privacy? Does it encourage them to seek appropriate human professional support? And the last point I want to say is that I agree with many of the other speakers that the effects won't be the same for every young person, like age, mental health issues, or underlying mental health issues, family relationships, culture, identity, and access to support. They all matter. An average result from some of the publications can have the patterns like one group is benefiting more from using chatbot, but the other group is being harmed. So we need to move beyond measuring only time and engagement. I think we should be measuring the more nuances, the emotional well-being, the trust, dependency, help-seeking behaviors, and what happens over time. Yeah, that's it.
Right,
Thank
thank
you.
you so much, Dr. Yu. I think very important questions. As someone who actually teaches AI to young folks and thinks about these ethical questions, definitely see huge amount of cultural divides as well as diversity in how folks are approaching this question. Great. So now, kind of still staying with the theme of the question of what we don't yet measure, and that takes us naturally to evidence. And so our next speaker, Hana Raj, is currently the evidence and insight manager at Girl Effect, and we're working across digital health, gender, and adolescent health programs in Africa and Asia. Over the past decade, we've led more than 15 end-to-end evaluations and more than 30 studies across 9 countries, including work on HPV programming in Nigeria and the evaluation of Go Nisha Go, India's narrative-based digital adolescent health game. So, Aparna, given what Zoe has just described, what do you see as one urgent evidence gap about digital adolescent health tools that we still don't have? And what do you think would genuine research co-ownership with young people look like in filling that gap?
Thank you so much for that question. And before I start to answer, I really want to thank you for inviting me. And I'm so excited to be part of this brilliant panel who are so invested in doing so much good for such an important cause. So, yeah, building on what Zoe said, we are not just measuring the wrong things, we are measuring wrong person, in my opinion. Almost the entire evidence base for digital adolescent health assumes an adolescent with private individual access to a smartphone. And that is not the reality for a big proportion of girls. I've been working across many countries in Asia and Africa, and I see that the digital reality isn't a black and white thing. It's not about whether somebody has a phone or doesn't have a phone. There are so many gradients in between that it's very, very nuanced and very important to study between those black and white lines. Phones are borrowed, shared, monitored by a parent, brother, a husband. A few years ago, we ran a massive study called Girls and Mobile, where we heard stories where a girl's phone was open to be monitored by a neighbor's son because the parents don't feel confident in monitoring her digital usage. So somebody is so much open to being scrutinized by almost anyone in her close community. Her behavior is definitely going to be much, much different from someone who has a private phone and has all the opportunities to keep everything to themselves. Privacy is a big thing. And earlier in this chat, somebody did say privacy by design should be something that we should focus on. And that is also something that we heard from this research I just now mentioned, Girls in Mobile, where we invited a bunch of girls to and gave them a couple of scenarios that for something related to entrepreneurship or for entertainment or for education, everybody had their thematic which they could pick. And they had to design, like conceptually design an app. We gave this exercise to boys as well as girls, and you would be surprised at the proportion of girls who were so much focused on how it can be more made more and more secure. How can you ensure that in certain contexts boys are not entering their platforms? How can you like ask for very personally verifiable information so that whoever is registering into these apps are legit? And no, there is no scope of anybody using a pseudonym or a pseudo gender and just entering. And then because most of them have been harassed by being online, and that is a big threat to them. So yeah, security, safety, privacy, and multiple layers of it was something that came up as a top insight, and girls want it. And this is something that needs to only and I mean that it can only start getting operationalized at a systematic level. Yes, I was talking about the different kinds of access, depending on who has what kind of access, their uses, how is it interrupted, who censors, and what data is seen by someone else. All of that determines our understanding of how we view digital usage of the adolescents. AI chatbots make this sharper because conversation history and conversation history on a shared phone is very different risk than browsing your chatbot, sorry, your browser history. Those can mean different things, and those can be monitored in a very, very different way. And like the way AI has entered our lives. Just now, Zoe was mentioning how people share emotional things about their personal emotional issues with the chatbot. It opens up somebody's very, very personal world for scrutiny and puts them in danger. And the second half of the gap that we are discussing is how evidence gets made. So I've led multiple evaluations in multiple countries, and there's one honest lesson. So Studies that change decisions were the ones that where young people were not just subject of the research but were inside the research. And one example I would give is there was a evaluation and which was a randomized control trial for a role play mobile game called Go Nishago. It was one of its kind, and it was probably one of the first RCTs for a SRH focused game for girls in India. And it was a massive success. And I think the majority of its success could be attributed to the reason how it was developed. And it was youth being the center of it, not as somebody you just as a token go and ask a couple of questions, but they were part of it from the beginning till the end. They were the ones who helped shape the objectives. They were the ones then with whom formative research was and with conducted. So the researchers themselves were young people. And we heard stories. I mean, it was very, very interesting. I will definitely share this one insight. It's very taboo in India to for a certain section of society to admit that you have a boyfriend, especially for girls. So we studied around 100 girls of 15 to 17 year old. 98 of them said, "My friend has a boyfriend who has then done something, something, something." So, even this level of details wouldn't come if an adult would have gone to conduct these interviews. And after that, we heard about how ECPs are being abused, how their male partners coerce them into sexual activities, and they ask them in exchange they ask multiple things. All of these things just makes a strong case for how youth needs to be at the center when it comes to designing solutions for the youth. Yeah, I would end my answer with that, and happy to take any questions later.
Fantastic. Thank you so much. So, our third theme is centering on research and innovation, transferring from that to policy and partnership. And given both time constraints as well as how comprehensively each speaker has touched upon this, we will go directly to Q&A, starting with two questions that we have already received from the audience that are open up to all of the panelists. And for those of you who have additional questions, please feel free to put that into the chat as well. Panelists are free to respond within the chat, and if there are any that any themes that are converging upon, and if time permits, we'll highlight those as well. But the first question that we'll field to the panelists, and this is from Arisola Olumide, is for what would you say are major concerns with adolescents becoming over reliant on generative AI for emotional needs, and how can these be mitigated? All right. And so I think speakers feel free to simply unmute if you would like, or raise your hand if you would like to speak. Let's see.
All right, yeah, I could probably can go ahead. Because one of the expertise of our lab is problematic interactive media use. We are having a few projects going on in terms of like a problematic use of AI. And our definition is like if we see using interactive media, especially using AI, it's replacing their real life relationships. If they rely more on AI to do interpersonal communication. They share a lot of personal experience, emotional experience with AI, but not a real person. I think it's a time for parents and clinicians, teachers to step in. We have to do some like media literacy stuff and let the kids know that AI is just generally respond to your request. They're not understanding you. So, because our research also shows that face-to-face communication, real friendships are more beneficial for kids' well-being. Interacting only with chatbot is not that um, is not that healthy. So we encourage parents, educators, to talk to their kids when they see the pattern that they're spending a lot of time interacting with chatbots. I feel like this is a great question. It's a great concern.
Perfect. Thank you so much for that. I think in the interest of time, let's go on to our next question, which I think from the audience is I want to ask if the speakers can briefly share their experiences regarding the role of adolescents, parents slash caregivers in the co-design, production, and utilization of health-related tech and AI tools. So this is also open to any speaker. Yes, Dr. Bewa, please go ahead.
Thank you. I can definitely speak on that because some of the work that we've led with Doodle pretty much was we came in with an idea about how can we use tools and technology to advance reproductive health, specific for adolescent and youth. And then we came in with that niche, as expert in every title, and we realized very quickly through our formative research on the ground with 40 plus stakeholders that, well, we wanted to focus on digital health telemedicine for adolescent SRH, but for everything primary care, general medicine, basic question about mental health and well-being, there was no digital tool that were addressing those type of issues and concerns. So what we're coming very niche, but then the market research with adolescent focus group and interviews in 4 cities in the countries, both urban, rural, and peri-urban, making sure that our personas is clearly identified, but also the diversity of users across region was also clearly targeted. We realized pretty much that it has to also encompass primary care, general medicine, emotional health, and not just SRH, because adolescents are not just about adolescent and youth are not just about SRH. Young women and young boys are not just about SRH. So that co-creation process and getting them on board, even at the formative stage, was critical in aligning our formats, our features, our functionalities, and some of the content, and even the way some of the icons for the appointment booking, for checking providers' availability, checking specialties, booking the type of specialty that they want, even the way the button needs to be displayed, centered, lateral, accessible, was fed into us by this co-creation with adolescent and youth. We also had that stakeholder engagement process where we talk with adults, parents, providers, NGOs leaders that are working in SRH, even multilateral folks that are funding projects and programs in adolescent SRH to also get their perspective. We went as far as hearing from experts in digital, not digital health, but digital data protection expert to also get the insight about some of the privacy concerns that we need to be aware of. So really that co-creation and really centering adolescent and youth has been critical from the formative research to the prototype testing, to testing the actual platform, to refining in it, to deploying in it, and also even having a first step evaluation to kind of get a sense of what are we doing right in terms of content utilization, data capture. And, we have received insight as part of this co-creation about some of the features that they want to see deployed in a year or two. And then from them, we learned that they want automated features and support that can also be available 24/7, in addition to teleconsultation, in addition to blog posts, in addition to video, in addition to GPS. They also want to have that automated features that can be available to them. So in a nutshell, that has been a practical experience that has been backed up by research, from research to implementation. And I think to sum up on this aspect, having a clear idea about what is the meaningful adolescent youth engagement that we want to have from the start has been the critical factor of success. And then establishing the Young Leader for Health Innovation from the start of the project has been a critical game changer.
Thank you so much for that, Dr. Bewa. And so in the interest of time, I think this might be the last live Q&A, but panelists, feel free to respond to the plethora of questions coming into the chat as well. And before we conclude with our online picture and our closing remarks from Eleni, I want to pass the torch to Dr. Maria to make some closing remarks for us. And thank you for gracing us with your time today.
Thank you. First of all, I will say that it was a fantastic webinar. It's very important to hear what the people that are doing the things think about what is happening. in relation with digital media and digital health interventions. As we know, digital media and digital health interventions can influence adolescent well-being in both positive and negative ways, depending on how they are used, for what purpose, and by whom. And that's the first thing I would like to comment. Technology is useful, really useful, but context matters. And you have said that there is not just a way that the adolescents are different, that we have to work with the schools, that we have to work with the communities, that we have to make youth participation not optional, it's obligatory. We have to have them. And when we talk about young people and the process, we are talking about every step of the process. When you designed, the intervention, when you implement it, when you finish it, when you supervise it, when you evaluate, and somebody says, and when months after that, what happens? No, because it's not just I make the intervention, is that all? So youth participation is not optional. And really, partnerships improve reach and relevance. And I come from Peru. I work with young people more than 40 years. I've been in the government, I've been in the NGOs, I've been everybody. So partnerships are very, very important, but with respect between generations. That's one thing that I always repeat, because I am a old lady. So it's very important to have respect. It's very important. Things that you say are innovative, creative. I think that we have to work together. It's important. And other thing is that equity should be central. I don't know who told. I think somebody from India. I don't remember. Not everybody has a smartphone. Not everybody has the possibility to be with digital ecosystem. Not everybody. So we have to think about that. So it's really clear that what you have shared is very, very important, that technology will accelerate adolescent impact only when paired with youth leadership. One, with trusted partnerships, because you have to believe in your partnership. If you are not sure about who are you working with, that's a problem. And with equity-oriented design. I think that if we talk about technology, the possibility of expansion is great. But when we talk about youth leadership, it's important because they are telling us what is important for them. And we always say, this is something that we say decades ago, nothing for them without them. ¿No? En castellano, nada para ellos sin ellos. We say this so many times, but as they say, sometimes that's not real, okay? And the partnership will bring us sustainability, because without budget, there are no rights. And we have to think that we have to have budget. And you know that the budget for adolescents and young people is very little across the world. We don't have much money to do these things. Thank you for this fantastic webinar. Thank you.
Thank you so much. Dr. Kale, for your fantastic synthesis, and definitely we'll be carrying that forward in our thinking as well, in terms of how to synthesize both top up, bottom down, and looking at the integration of youth voices not only as optional but mandatory. Great. And so with that, we are showing again the QR code for joining, and so we'll flash that up at the end. But given everyone's participation, let's go ahead and take a group photo. So if you're able to, please turn on your cameras, and we'll take a screenshot of all those who are present to commemorate this wonderful gathering of minds. And then we'll pass it off to Eleni for final remarks. So gonna go ahead and go through the screen. So I'm just gonna give about 5 seconds for everyone to turn on your cameras if able to, and we'll do 2 rounds, one with the first page and then the second round with the second page of profile photos. All right, so we'll be taking the first photo just in a second. So I'll count everyone down, and hopefully everyone is ready with your cameras on. So we'll do in 3, 2, and 1. Perfect. So that's first photo done. And then we'll do a second round of photos with the second page of participants. And so I would again count us down for here. So that will be 3, 2, and 1. All right. Great. All right, thank you everyone. And then last but not least, we'll pass it off to Eleni for the final remarks.
Thank you, Minju. As we close today's discussion, one message has emerged very, very clearly across all the themes that we discussed, that the future of adolescent health depends on how effectively we connect people, evidence, technology, and also our policy. We heard that meaningful youth engagement is not simply about representing, it is about co-creating opportunities for young people to contribute to decisions, to research, and to programs in a substantive way. This is where the IAH Emerging Professional Network has an important role to play, bringing together the next generation of clinicians, researchers, public health professionals, and also advocates across disciplines and generations. So we would like to invite everyone once again to join today to the next step with us by using the QR code on the screen to join the IAH Emerging Professional Networks and stay connected with the new opportunities, activities, and also collaborations that we are trying to develop. I would also like, before closing, to invite everyone again to join us for the International Adolescent Health Week 2026 from 12 to 18 October. And this year is particularly special as we celebrate the 10th anniversary of IAHW. It is a theme that connects very beautiful with today's discussion, as it reminds us that adolescents should not only be the recipients of our policies, but meaningful partners in shaping them. On behalf of all EPN co-chairs, I would like to thank our moderator, all our panelists, and every one of you who joined us today for this excellent multidisciplinary discussion. And we still hope that the connections that we made today through this webinar will continue beyond today through new collaborations, new research, and better health outcomes for all adolescents across the globe. Thank you very much, everyone.
Thank
Thank
you
you.
all.
Thank you.
Thank you.
Thank you.